Hi guys, this is Dr. Jamin Singh Rao, and today we are going to discuss about the topic dementia in this session. So, guys, first of all, I would like to share one dementia topic. So, first, beginning with the sharing a slide of it is a topic of CNS, and CNS is a topic of general medicine. So, guys, as we know that dementia is a neurological deficit, so you can see the um, what are the major cognitive impairment of daily activities affected in the dementia. So, guys, you know that diagnostic criteria for the dementia. So, more than one of the following function are affected. These are six categories that are criteria, and if more than one of these categories will be satisfied for the diagnosis of the dementia. So you can see that memory, you can focus on this. So what are the detail? You can know that memory, language, executive function, social cognition, perceptual motor, complex attention. These all are six components of criteria for the diagnosis of the dementia. So, in memory, the medial temporal lobe or hippocampus that is affected. In language, Broca's area, inferior frontal, that is part of Broca's area, very inferior frontal and inferior, and Wernicke's area that is superior temporal. So superior temporal, you can know well known by watching your anatomy's video and diagrammatic view the Broca's and the Wernicke's area. So language, then after executive function like a dorsolateral prefrontal cortex that is available on the dorsolateral, and after social cognition, orbital prefrontal cortex, perceptual motor, praxicone, superior parietal lobe, complex attention, orbital prefrontal cortex. What are the functions of the prefrontal cortex? You can see that there are important functions that is important for the prefrontal cortex, medial, orbital, dorsolateral. So energization and motivation. Note lack of energization and motivation. That is called apathy, resulting into apathy. So that is function of medial part. Orbital part, prefrontal cortex. So associate with the one trick. That trick name is GIFA. What is GIF? GIF, GIF J I P F A A. So J stands for judgment, I stands for insight, P stands for personality, fluency, abrupt thinking, and attention. That is A for attention. So GIFA, that is the trick to remember the orbital part. Then dorsolateral part executive function, as I told you. Now we move further. What are the causes of dementia? One of the most major causes is Alzheimer's dementia. Age related. Then after that is diffuse Lewy body dementia. Then after vascular dementia. We have discussed this all in this video right now at this place. So what are the other causes? Frontotemporal dementia, Pick's disease also called. Normal pressure, hydrocephalus, prion disease. No, 10% of the dementia are reversible, which is due to any drugs, due to any vitamin deficiency, chronic meningoencephalitis, or due to any normal pressure hydrocephalus autoimmune condition. Another. So these are 10% cause of the dementia which is reversible, so no need to worry. So rapidly progressive of dementia, like the dementia is at this stage and it is rapidly progressive. So rapidly progressive dementia, frontotemporal dementia, prion disease, diffuse Lewy body dementia, HIV, and Whipple's disease. Among these, also called young onset dementia. So there are three: frontotemporal dementia, prion disease, or diffuse Lewy body dementia. These three are young onset. Another that are is not young onset; they are in the elderly or any age group that can be takes place. So note, in every young patient, always rule out chronic meningoencephalitis and autoimmune pathology. Guys, first of all, I discuss about the Alzheimer's and dementia, also called tauopathy. There will be a degenerative or accumulation of the protein in the brain, which is known as a tauopathy. So tau now protein will be accumulation. So what is the pathogenicity? So when APP gene on chromosome 21 is mutated, so amylogenic pathway A beta amyloid will be formed. It results into two part: A beta 40 cerebral amyloid angiopathy, A beta 42 Alzheimer's disease. That result in Alzheimer's disease. This result in cerebral amyloid angiopathy. So what is the amyloid deposition? So A beta amyloid result into outside neuron, inside neuron. What is in the outside neuron? There will be outside neuron amyloid plaque. In inside neuron there will be a neurofibrillary triangle. So in the this both result into the both composed of hyperphosphorylated tau cause neural toxicity. So that is the tau which is causing the neural toxicity. Neurals that are neurons that result into toxic condition. So due to which there will be tauopathy results takes place. So this is the pathogenicity of Alzheimer's. So note no proven risk factor are present for Alzheimer's disease. So no any proven risk factor has been noted. So stage of what are the stage of Alzheimer's disease? There are four stage of amnesia, anosmia, and visual spatial disorientation, executive dysfunction. Fourth stage. First stage amnesia, and fifth then anosmia, then visual spatial disorientation, in which the non-dominant parietal lobe is affected. Here, the most of the student who are using their right hand to for dominant, so their left part is not affected. There will be no dominant part, that is the right part. Then will be affected. So it's vice versa takes place in the both types. So guys, what are the executive function? Prefrontal cortex, administrative function that will be affected. So note lesion of angular gyrus, adjustment syndrome, acalculia, finger anomia, right to left disorientation, alexia of agraphia. These all are the lesions that takes place in this. There is one of the topic that is alexia without agraphia. Splenium of corpus callosum is involved. Visuospatial disorientation, constructional apraxia, dressing apraxia, hemispatial neglect, involvement of non-dominant parietal lobe. These all are result into what are the treatment now? What is the treatment? Ultimately, we have learning this, and we have to aim. Our aim is to treat the disease. So treatment is rivastigmine, donazepam, donazepam, or tacrine, cholinesterase inhibitors, or mematine, that is NMDA antagonist. These are all the treatment. What are the other types of dementia? Frontotemporal dementia and Alzheimer's dementia. Here will be a tauopathy also takes place. Here also tauopathy takes place. Here MAPT gene on chromosome 17. So loss of function takes place. Young onset, 30 to 40 to 50 years, 30% genetic, and rapidly progressive prefrontal cortex function loss. Here will be a rapidly progress. So what is the about the Alzheimer's disease? The presenilin one chromosome which is present on chromosome 14, presenilin chromosome 2, which is chromosome 1 present, and ApoE4 late onset. The ApoE2 are early onset, lower one is late onset. Late onset means what age? More than 60 years, 5% genetic, slow progression, and prefrontal cortex involved in the later stage only. One of the interesting thing I would like to discuss about the Alzheimer disease, one of the great politician that is Bihari Vajpayee, he was suffering from Alzheimer disease. So it is very important for an old patient, very much for an doctor. So what are the diffuse Lewy body type of dementia? Also called as a Parkinson plus syndrome. Subcortical dementia characteristics by Lewy body alpha synuclein in the neuronal cytoplasm. Note alpha synucleinopathies, Parkinson's disease, diffuse Lewy body dementia, multi-system atrophy. These all are the characteristics. What are the clinical features? REM sleep, rapid eye movement, sleep disorder will be takes place. Autonomic nervous system will be dysfunction. So earliest symptoms are these. What is REM sleep will be disorder and ANS dysfunction. Dementia then is more than rigidity, which more than tremor. Tremor will be takes place. So Fluctuating alertness or consciousness will be affected. Visual hallucination will also be takes place. Worsen of the symptoms on starting antipsychotics. No response to levodopa. Very bad. Note cortical dementia versus subcortical dementia. What is the cortical and subcortical? Here will be tabulated form. I have explained what are the diseases which comes under cortical. This will be listed in the this table. What are the disease that is coming in the subcortical that are listed in this table. So guys, severity very severe, less severe. Apraxia, aphasia, agnosia, positive, negative. Extrapyramidal symptoms, negative, positive. Corticobulbar involvement, no. Yes, yes. Emotional involvement, no. Yes. That's all are the disease about the dementia. So Creutzfeldt-Jakob disease is also we will discuss in dementia only. So it is prion disease, young onset dementia, beta plated seat of prion. So it is known as a, that's why it is called as a prion disease. PRPSC, see, protein involved. These all are code for a protein. So rapidly progressive takes place. Dementia plus myoclonus plus high voltage sharp wave in low slow background of EEG. That is the clinical features of the one of the prion disease. That is a dementia myoclonus plus high voltage sharp wave of low slow background of EEG. So guys, one of you have to remember this. Vascular dementia. What are the causes that cause responsible for the vascular dementia? Post-stroke, that's vascular dementia, multi-infarct state, stepwise decline in cognitive function. Small vessels stroke, lacunar stroke, that is risk factor of systemic hypertension, pathogenesis, lipohyalinosis, white matter disease, that is a Binswager's disease, sorry for mispronunciation, Vince Wenger's disease, subcortical involvement, characteristics by emotional fibers affected, corticobulbar gait issue, urinary incontinence takes place. So, what are the normal pressure that of hydrocephalus? Defect. So here we'll be discuss about the dementia only, but one topic after in this in normal pressure of hydrocephalus. Defective CSF absorption. So characterized by ventriculomegaly. Clinical features of Hakim's triad. There which is good is a trick to remember. So gait issue, apraxia, ignition, food phenomena, urinary incontinence, dementia subcortical, and the treatment is surgical. Your treatment. So now motor disorder is another topic and which covers in the Parkinsonism. It is the next video. Thank you for watching this video. I hope guys you like this video of and thank you for watching. Radhe Radhe, Jai Shri Krishna Bhagwan, Jai Shri.